The following is a CTV News Calgary special presentation.
He laid there for a very long time. It's hard to watch somebody you love slowly die.
You call them in a medical emergency.
When you placed the 911 call, what were your expectations?
But will an ambulance arrive when you need it?
The public is starting to realize that it's at a breaking point.
Kathy Lee investigates. Broken system. EMS crisis in Alberta.
In a time of crisis, most of us assume a call to 911 will lead to an ambulance arriving quickly. This is the case for many emergencies in Alberta, but when it's not, the consequences can be devastating. Dawn and Andy Anderson were soulmates. They were inseparable.
Amazing man. Love of my life.
But everything changed early in the morning on January 18th, 2022. Dawn woke up, but was then in and out of consciousness.
He just felt dizzy, and then he fell back, and then everything just all at once. He was walking around. I mean, he wasn't eating, but he was mobile. And then all of a sudden he fell back, and that was the end of it.
Panicked, Andy dialed 911.
Ambulance dispatch for what town or city?
Calgary, please hurry.
Tell me exactly what happened.
He's seizing or unconscious. He had major surgery. He has heavy-duty staph infection.
So I'm sending the paramedics to help you now. Stay on the line and I'll tell you exactly what to do next.
Okay,
Reassure him the help's on the way.
He had hemorrhage through his bowels, so most of his blood was on my floor at home. He laid there for a very long time, and you know, it's hard to watch somebody you love slowly die, and there's not a thing you can do to help them.
So we don't have an ambulance dispatch at the moment, but as soon as we have one available resource, we'll be sending them right away.
Well, like, how long is this going to be? Like, holy...
I don't have an ETA at the moment.
When you placed the 911 call, what were your expectations?
To have an ambulance, to have somebody, you know, not ask me how many times for my address. It should not take 3 calls to get an ambulance. That's horrific.
The ambulance arrived at South Health Campus at 7:20 a.m. By 10 a.m., 57-year-old Dawn Anderson died 2 weeks before their 13th anniversary.
When he died, I died. Like, my life has been turned upside down. I'm coping. I'm dealing day by day with life. I don't enjoy life like I used to. I think I just kind of go through the motions. So some days are easy, some days are not so easy. Some days you're more angry, and some days you're just like, you cry.
In Alberta, 911 calls for medical emergencies are triaged and coded into levels of increasing urgency. Alpha calls are considered minor. Then there are Bravo, Charlie, Delta, and Echo calls, which warrant lights and sirens. Firefighters automatically assist EMS with Delta and Echo calls, which are reserved for high-priority patients having issues like a heart attack, serious bleeding, or they're unconscious and aren't breathing. Freedom of Information records show the operator had coded the first 911 call as Alpha. 50 minutes later, it was upgraded to Delta, and an ambulance was dispatched. Don Sharp is a retired paramedic of more than 40 years. He worked as a dispatcher in the early days of his career and also trained new recruits.
The initial call taker Sounded like he was asking all the right questions, getting the right information, but then I see that it was sent not lights and siren, as a cold response. And based on what I heard, that call should have at least gone lights and siren.
Do you believe in your heart that if an ambulance had arrived within a reasonable amount of time, that he could have been saved?
I don't know. I really don't know. All I know is he wasn't given the choice. I believe he was completely let down by our system, and I was let down. Nobody should have to watch, and there's nothing you can do to help the person you love, and you're sitting there doing, and you're helpless.
Andy also wonders why she was told an ambulance was dispatched when it wasn't.
And that is one I cannot forgive. If you're not going to send an ambulance, don't say one's on the way. Like, you can't do that to people. These are lives you're playing with. I don't know why it was done. I don't know if they were new or untrained, but they lied to me. And had I not called back, my husband would have died at home.
An emergency communications officer, or ECO, in dispatch agreed to an interview. We're protecting their identity as they fear discipline for speaking to us.
We're not allowed to tell the public that an ambulance has not been assigned to their call. That's the hard part, is when you're literally lying to somebody and telling them, like, we've got somebody on the way, our closest available unit is en route, and they're like at the bottom of the queue.
That must be hard for you guys to have to lie.
Yeah, like just thinking about my own relatives, I would never ever want to, have them in that sort of scenario. We could get reprimanded for saying, like, do you have a neighbor, or can you take a taxi, an Uber? And sometimes those are way better options.
Has anyone suggested that?
There have been a few call takers who have done it, yes. And then we ended up getting an email saying, like, you guys have to continue to follow our protocols, and you cannot tell the public that one's not on the way.
So lying to the civilian and telling them that there is an ambulance on the way, even though there's not, that's part of the protocol that you guys have to follow.
Yes.
Ethically, isn't that wrong?
Of course it is.
Alberta Health Services wouldn't comment specifically on the protocol, but said an ECO follows a stringent set of internationally accepted guidelines to evaluate an emergency efficiently, and that estimations about ambulance response times or status are not provided unless requested by the caller. This ECO says ambulances not assigned to a call is the norm these days because the province is in a constant state of red alert when no ambulances are available to respond to a call. That means they can't keep up with the 911 emergencies flooding in, and ambulances can't be dispatched. Records CTV News obtained shows some of the longest dispatch responses in Calgary this year ranged from 1 hour and 22 minutes to 7.5 hours for Delta and Echo calls. But there were also long dispatch responses of more than 6 hours for emergencies prior to 2018.
But you'll have around 20 calls just sitting and pending, and sometimes they've been waiting for hours, and they try to have people like our ECOs call them back, but we are not medical professionals. We should not be making the choice on who gets an ambulance and who doesn't. That's become part of the job.
When calls are impending or in the queue, a deep red alert has been reached. The province only started formally tracking calls impending in August 2021. Comparing numbers from last year to this year, in Calgary there was about a 1,400% increase in calls impending, while in Edmonton, that increase was more than 900%. More calls impending plus long dispatch times means longer response times. AHS records show the average response times for all types of calls with an advanced life support ambulance in Calgary jumped from just under 13 minutes in 2021 to about 24 minutes in 2022. Some of the longest response times to Calgary this year for all types of calls ranged from 1.5 hours to almost 11 and a half hours. But there were also long response times ranging from 4 to close to 7 hours prior to 2020. Response times in Calgary that are more than 30 minutes long are still rare, but in the last 8 years, it's grown to 18% from less than 1%. As for where the ambulance is responding from, it may not even be in Calgary. Most are, but records show completed calls to Calgary came from as far as Edmonton, Sherwood Park, and Medicine Hat.
So this is her garden?
Yeah, this is her domain. This is her love.
A long ambulance response time might have sealed the fate for Candace Speck's aunt, Betty Ann Williams, called Rusty by friends and family. The 86-year-old loved her garden and was eager to spend more time outside, especially after recovering from cancer.
Yeah, you know, she was a fun, just all in it girl. You know, she loved her sports. You know, she was in the service. She just loved life. She's just retiring and getting out in the yard every day, and that was her happy place. That's all she cared about.
On June 5th, 2022, Rusty was in her back alley pruning weeds when she was mauled by her next-door neighbor's 3 pit bulls.
I hear this, help! And I'm kind of startled and like, I was almost like, did I actually hear that right? And at that point, my husband happened to just come out and go, what's going on? So I was telling, it looks like there's some dogs. I think they've attacked somebody in the back alley. So we go out there and he's like, call 911.
Nicola Opsel, another neighbor, made the 911 call at 2:01 p.m. She says a bylaw officer arrived shortly, as did an ambulance, but it wasn't for Rusty, and drove by.
What the hell is going on? As time is going by and no one else is showing up, I'm getting more and more upset. The bylaw officer, like I said, he was literally on his radio, continually trying to get somebody here. So, I mean, I can only imagine, we were frustrated. I can only imagine how frustrated he was.
AHS says the city was in red alert and that it took paramedics 30 minutes to get to Rusty. She died on the way to hospital.
And next thing you knew, a doctor came in and she just sat right in front of me and just said, sorry to tell you, but she's gone. I just couldn't even believe it because I was like, it's a dog bite. Like, what are we talking about right now? Disbelief, dread. It was just like every emotion in the book, like anxiety, panic. I was angry, you know, it was just every little fiber of me was just tingling, you know, and I think I was just trying to block it out more than anything of the disbelief of what actually happened. I couldn't touch her. They wouldn't let me kiss her. The damage was so extensive that they didn't want more trauma to me. But basically, she was just shredded from head to toe.
AHS says the call was coded as non-life-threatening, and it wasn't until a second call was placed to EMS about the seriousness of the injuries that an ambulance was dispatched. Records show the ambulance responded in 9 minutes and 53 seconds, but it wasn't dispatched for at least 20 minutes. From the time Opsel made the 911 call to when the paramedics showed up, nearly 40 minutes had passed.
If somebody would have just called me, I could have got here faster from my work. I could have taken her in my car to the hospital in a shorter amount of time than it took them to get here.
Opsel feels AHS blamed her for not relaying correct information about the emergency.
You know, had they showed up sooner, you know, would she have lived? I mean, we don't know, but I worry, you know, did I say enough? Was I, you know, urgent enough on the phone?
Do you feel guilty about that?
Yes, I do every day. I want to know, what did I do wrong?
How would you describe the system, the EMS system?
It's terribly run. You know, it's sad that they don't have enough ambulances or people to run them or anything, and it's like, how did we get here? Because every day you hear ambulances going by, flashing all day, every day, you know, and just wondering like, well, why were they so close, you know, every other day, and then the day that she needed them and nowhere to be found.
You never think when you're going to make that phone call that there's nothing going to be available. Like, that literally scares the hell out of me. as you know, somebody that's getting older. What if that's me that happens to?
The owners of the dogs won't face criminal charges. Calgary police said the couple took reasonable steps to secure the dogs and there was no sign of malicious intent. But the city will pursue 12 charges under the responsible pet ownership bylaw, something the lawyer for the owners plan to fight.
I'm just heartbroken and I don't know if I'm ever going to recover from this.
And recovery for Andy is a long road, but the memories of Dawn gives her strength.
He was into Harleys. We would go riding. We were supposed to do a big trip this summer. I went riding with a friend 2 weeks ago on his bike. As much as I loved it, it was bittersweet. All I can think of is I'm supposed to be doing this with my husband.
Until that day comes, telling her husband's story is her way of honoring him.
I have no faith in 911 anymore, and that's a shame. People need to know that it's bad, and it's really bad. And it's not just my story. There's many, many more stories. And I'm sure there'll be many, many more stories to come.
The EMS system in Alberta is connected, which means when big cities like Calgary or Edmonton go into red alert, surrounding communities are impacted too, and can often be left without an ambulance to help their own citizens. Not having an ambulance is what Leah Lucier and her son Braden experienced back in January. Her 10-year-old has an extremely rare genetic disorder and is considered high risk for medical complications. When he fell on the ice outside their home and broke his femur, it was serious.
The biggest thing with a femur break is that you are right next to a major artery. So with a broken bone in that area, all it takes is a nick to your artery. So I didn't know, was he bleeding internally?
They called for an ambulance, but there were none.
For Braden, being 10, he's been a medical kid. He has lived at Children's for a lot of his life. And he knows how it works. Mom calls an ambulance comes, and we go to the hospital.
But on this day, 45 minutes passed, and still nothing.
Braden was just crying and saying to me, I don't hear the ambulance. Where are the ambulance, Mom?
It was at this point Lucier called 911 back and begged for the fire department to come and take Braden to Airdrie Urgent Care.
I knew the system was bad. I had heard the news. I had watched the news about, the lack of ambulances and that too. But to live it was severely traumatic.
Were you in shock with how much worse it was?
I was horrified because, I thought there would be a wait, but to have to beg for somebody to come was just beyond, I was beyond flabbergasted. It was like, how is this even a thing? We live in Canada. We have medical that's great when it works. And, I was absolutely dumbstruck that there was nobody that could come.
Airdrie officials confirmed that at least one day in September, the small city had 0 ambulances for a few hours, and that the longest the local fire department had to wait before paramedics arrived this year was almost 47 minutes. So why doesn't an Airdrie ambulance stay in Airdrie? It's because of the borderless system in Alberta implemented when the province took over EMS in 2009. That means ambulances from anywhere in Alberta can also respond to emergencies outside their communities if they're closest. But being close doesn't necessarily mean help is actually close at all. Sometimes it's more than an hour away. Those same ambulances can also be relocated or flexed to serve other communities if they are needed.
Well, that borderless system was told to the rural communities that was going to be a great advantage, because when your truck left, another truck would move into cover. And they would be constantly moving trucks around and making sure coverage, well, that was great in theory.
In reality, AHS data shows that since 2014, an increasing number of ambulances from small communities are responding to emergencies or being flexed outside their jurisdictions, especially to Calgary. But the same level of response or flexes from Calgary ambulances to smaller communities hasn't been reciprocated. If we look at Cochrane, between 2014 and 2021, its ambulances responding to Calgary increased by 500%, but those same ambulances responding to Cochrane decreased by 58%. As for flexes, Cochrane ambulances requested to flex to Calgary increased by 35%, but Calgary ambulances requested to flex to Cochrane decreased by 47%. Brian Winter started EMS services in Cochrane in 1983. He says the lack of ambulances in his community is felt even more when their fleet gets pulled into big cities during red alerts.
For a Delta call, they could be waiting up to 20-25 minutes for someone that needs EMS treatment right away. And if the units were in Cochrane, Cochrane's not that large. You can be within Cochrane probably 5 to 7 minutes, right? Which is a reasonable response time. But when you're coming from Banff or coming from wherever else, or trying to get a unit cleared from the foothills or some northwest or southwest Calgary, it's just way too long.
AHS data shows some of the longest response times for the most severe emergencies in Cochrane even reached more than 52 minutes this year. And you can't blame the pandemic. Even before it, there were long response times of up to an hour. And the same is happening in Airdrie. Some of the longest response times were close to an hour for Delta and Echo calls, leaving some families with little choice.
A fire truck had to transport your son to the hospital.
It's not something that they do. It's not part of their jobs. They had to break protocol to do that.
And the Airdrie Fire Department isn't the only one that had to break protocol. In the early hours of June 26 this year, the Calgary Fire Department transported 3-year-old Tara Agarwal to hospital after she fell on her head and started seizures.
Yeah, as a parent, I think all parents can understand this, but like the same eyes she uses to look and say, "I love you, Papa," those eyes are rolled back in the head and you can't see them. You freak out as a parent.
Our heart dropped a little when we heard that there was no EMS available. And luckily, there was someone trained in emergency medical services on the team. They told us a decision had been made to transport us in the fire truck, and I'm so glad that they did. We got to Alberta Children's Hospital. They had a team ready for us, and her oxygen was actually really low, so it was very critical that she got there as soon as possible.
She and her parents were visiting from Toronto and were able to reunite with the firefighters who helped save her life. Tara's parents initially thought Calgary firefighters routinely transported patients to hospital and said they were shocked when they learned that wasn't the case.
That day I really wanted EMS, and I wish we could have had EMS so that she could have gotten out of van, and but I'm very thankful that the fire department was trained and was able to get her there so fast.
AHS records confirm the call was coded as Delta, and it took EMS about 20 minutes to arrive on scene.
The individuals who are working on the street right now are working as hard as they can to make the system work. But obviously, organizationally and systemically, there's a challenge that the administration of AHS needs to be listening to, because what's happening right now, frankly, is unacceptable.
Up until October this year, the Calgary Fire Department transported 4 patients to the hospital. Calgary police don't track that information, but officers are doing more and more transports, including a call to a bar in Kensington this summer for 29-year-old Brandon Sklenka.
I just woke up to an alarming text message that he wasn't in the right mental state. So I was at home and I called 911 right away.
But an ambulance didn't show up right away. Records show a paramedic response unit, or PRU, did 14 minutes and 44 seconds later. It's staffed by a paramedic but can't transport patients. Medics say when a PRU arrives on scene, its arrival time counts as a response time for the call, also known as stopping the clock.
Do you remember saying anything like, "Where's an ambulance? What's going," like anything like that you recall?
I remember them saying that they didn't have a stretcher, so they're running back and forth trying to figure out because they didn't have a stretcher, and I'm like, that's just scaring me more because I'm like, oh, why isn't there a stretcher? Why isn't there an ambulance?
25 minutes passed and still no ambulance. AHS documents confirmed 2 other ALS ambulances were dispatched, one from Airdrie and one from Calgary. But before they arrived, Calgary police made the call to take Sklenka to the hospital. But it was too late. Sierra Payne's partner of 8 years died.
It honestly just didn't seem real. Like I kept like waiting to wake up from like a nightmare. Like every emotion you have in your body, like a tornado that's just like overwhelming and you don't know what to do. He was great, like the brightest part of anyone's day, could make anyone laugh. Just had that kind of personality where he'd walk in the room and everyone just smiles because he would have a stupid joke or start whistling. He had a ridiculous whistle. It's not that the staff aren't trying their best. Like I know the first responders with Brandon did everything they could, but they're already not given a fair chance too when they get somewhere and they've lost that time or they don't have the proper tools or equipment.
Traumatic incidents like Brandon's aren't easy for police either. An officer on scene has to make the difficult decision to take a patient to hospital. And because this is happening so often, police and firefighters are now able to call a physician who can give them direction. Deputy Chief Chad Tofik says Calgary is the first police force in the province to implement the physician call line protocol.
Do you have enough resources to be able to take someone to the hospital?
We've got a lot of work in front of us as well. Our staffing challenges are not unlike other emergency services, and I think you see that across Canada.
Would it be acceptable if this became a norm?
I don't think it would be because our members don't have the training. Like that's not our specific mandate, and there are people who have that, and ultimately we want the best for the people that we're serving. And ideally in the long term, I think we'd want to see EMS and AHS have the capacity they need to respond in a timely manner to all these situations. But in the absence of that, we got to do our part.
It seems like they're accepting that this is okay, that CPS is going to be transporting people as often as they do, rather than fixing like the stem issue of that shouldn't be happening regardless. So it just seems like acceptance of a problem rather than fixing the problem.
Meanwhile, Lucier and Braden are both working to get through the trauma of their incident. As they try to move forward, Lucier knows that with Braden's condition, they might have to go to the hospital in the future for an appointment or an emergency.
How confident are you that if you needed an ambulance from here on now that there would be one?
0. And I am disgusted by that. If I could keep him stable enough in whatever situation I needed an ambulance for, I would try my hardest to take him in myself. But I have absolutely 0 faith that even fire would be available at this point. When we were in the fire truck, all 5 of Airdrie's fire trucks were doing medical calls.
Paramedics in Alberta warned about the declining state of EMS well before COVID-19. While the pandemic added more strain, those working the front line say the crumbling started years before.
I'm Mackenzie Payne. I'm a paramedic working in Alberta, and Sierra is my sister.
Mackenzie Payne agreed to an interview, but is sharing his personal opinion and doesn't speak on behalf of Alberta Health Services.
Do you feel like your job is at risk by talking to us?
Yes, I am a little bit.
But after what happened to Sierra's late partner, Brandon Sklenka, who was transported to hospital by CPS when EMS didn't show up, Payne couldn't keep quiet.
My worst fear in all of this has always been that an ambulance wouldn't be there for my family, and then it happened.
Payne says morale is the lowest it's been in his 15 years. Paramedics are overworked, tired, and stressed.
People are getting frustrated more and more and not able to manage that work-life balance that's so important. Sleeping problems, people being on medication to sleep, mental health issues, I think it's gotten worse and worse. Some people do a 24-hour shift, even up to a 96-hour shift, so you need time to turn off sometimes, right? Especially some of these calls are high stress. You need to decompress from seeing some of this stuff.
A Freedom of Information request shows this year Alberta paramedics worked an average of about 676 hours of overtime per day and were off on sick leave for about 650 hours per day. Both those figures have doubled compared to 7 years ago. So many paramedics are off, ambulances were shut down about 520 times per month in Calgary this year because AHS couldn't staff them, compared to 5 years ago when ambulances were shut down about 10 times per month. Mike Parker, president of the union that represents paramedics, says on average there are 600 unfilled paramedic shifts per week across the province.
We stopped taking care of the paramedics on the street. We expected them to be a disposable product that we could just replace at any time. And that reality has set in as we've seen decreases in our resource levels.
The strain is also felt in this room. This emergency communications officer says after dispatch consolidation for remaining municipalities in Alberta, including Calgary in 2021, the transition was chaotic. There wasn't enough staff and they weren't trained properly. Now the strain is even worse because many are burnt out. AHS records show since 2015, the number of emergency communications officers off for sick leave has more than doubled, and overtime hours worked has more than tripled.
There was a note that we have that describes an evening in this province, and it was a weekday evening, and there were 4 people answering 911 calls in the province of Alberta for our paramedics. 4.
And this means potentially more mistakes.
You should at least have a year as a call taker to train before you get moved to dispatch. Now they're pushing people through after 4 months.
Yes, and it's very easy to forget how to call take once you go over to dispatch, and you need to be very well versed in it in order to be a good dispatcher. If it's not coded properly, then it comes out as a lower acuity call. This person may actually be in a lot more medical distress or whatever, and they don't get the resources because we don't have anybody to send, so they're overlooked.
Has that happened?
Definitely, yep. It makes it hard to go to the job, and it makes you incredibly frustrated. Yeah, it's not a good feeling to work for a place that doesn't care about you or how this makes you feel at the end of the day. And they're also telling, callers that we don't care about you either.
Alberta Health Services has blamed the strain and lack of new recruits in the last few years on everything, including the pandemic, weather, wildfire smoke, opioid crisis, to low birth rates.
This problem has not been going on for the last 2 years. It's not COVID. There's always seemed to be some excuse, but it's been going on for a long time. The public is starting to realize that it's starting to break. It's at a breaking point.
Our cities have continued to grow. Our province continues to grow. So our resources need to match the growth of our population and call volume increase, and they haven't.
According to AHS data, since 2009, the population in all health zones has increased, with the Calgary zone growing the most. Calgary zone's population is 3 times that of the central and north zones, yet all of them have about the same average number of operating ambulances. And when there are no resources, red alerts happen. The numbers in Calgary have been growing over the years, even before the pandemic hit. The number of red alerts in Calgary almost tripled between 2017 and 2018. And this year, the average number of red alerts per day is 15. Compare that to 6 red alerts per day the year before. But AHS has consistently said the red alerts don't last very long. But this retired paramedic says that's misleading.
And then they say, oh, no, red alert's off, because we have 1 ambulance available in the Calgary zone, which includes Airdrie, Cochrane, High River, Okotoks, Strathmore. That ambulance could be in Strathmore. That's the 1 ambulance that's available. They canceled the red alert because, okay, now we have an ambulance available. It's dishonest.
The code red conversation is when there was a tornado or when there was a massive disaster. It's to alert all available resources that something big has happened. Today it's thrown around as just another day.
So how did we get here? Was EMS in Alberta always like this? Not according to these 2 men who were employed when EMS was run by the city of Calgary. Don Sharp says medics didn't have to routinely work past the end of their shift. They'd have time to eat, rest, and train.
We were enthusiastic about going to work. We were proud of what we did. We had great leadership, and we felt like we had a real stake in what was happening. They listened to us as frontline providers, and we were part of the, not just part of the present, but we were part of the future.
We were probably the top 10 EMS in North America. Doing great, and that spun off into Alberta too. I mean, Alberta from 1972 on led EMS across Canada. We had autonomy to create. If we had an idea, we could work it through.
Dwayne Clayton says the autonomy to share and implement ideas to improve EMS came to a halt in 2009. He was in the room when the province announced it was taking over.
The idea that you could hear a pin drop in the room was exactly it. The only sound maybe was people's jaws dropping and hitting the table. Because in all the scenarios that had been thought of for us, that was the worst.
AHS says the reason for a centralized system came because municipalities wanted government funding for EMS, and it was a way to standardize patient care across Alberta. Paramedics were told there would be no degradation of services.
They come in and said, here, we're going to take it over, and we're going to increase the number of cars that service Cochrane. Well, in 2009, we had 2 cars. 2022, we still got 2 cars, and the population has doubled.
By 2012, it became obvious to me that there were lots of problems with this new system. Hallway waits were getting worse. Response times were lengthening. The equipment that they said they were going to give us wasn't materializing. The level, the standard of care, the training we were receiving was starting to kind of fall off.
Don Sharp says hallway waits are the main reason people who call 911 are not getting emergency care when they need it the most. It happens because paramedics are required to stay in the hospital with the patient because there are no emergency beds to put them in. Paramedics started doing this before the province took over EMS, but it's gotten worse. Many are now waiting in hospitals their entire shift and can't respond to calls. In the case of Don Anderson, although the ambulance arrived at the hospital around 7:20 a.m., the paramedics weren't cleared until 2 hours later.
Even after my husband got to the hospital, they left him there in the bay. Why is he sitting in the bay?
Sharp says there are other countries where hallway waits don't exist. He worked in Israel for a few years and says they have a more efficient system.
In Israel, when I get to a hospital, I don't talk to a triage nurse. But as a medic, I'm supposed to know where in the hospital I'm taking my patient. I go directly there, I patch if it's necessary to give them a heads up. I give report to the first nurse I see. I put the patient on the bed with their help. The patient goes to, I'm not even sure what room they go to. And then I leave.
The reason for hallway waits is access block, when patients are unable to move from the emergency department to a bed in the hospital. Dr. Peter Jameson says recently more patients are going to the emergency department. The number of sicker patients has also increased, and there is a shortage of staff. However, he says access block has been an issue for years because hospital beds are taken up by patients who can be elsewhere.
It's not the patient's fault. It's because they have a particular set of needs which could be met in other places. We just have to get the services in the community organized or funded for them.
But Dr. Jameson says efforts are underway to keep patients moving out of the hospital quicker, to free up the emergency departments, and allow paramedics to get back on the road.
I think we're kind of at a really low point in EMS right now, but did you ever think about that? What this is going to look like in 5 years?
I do, but if you would have asked me 5 years ago if it would be here right now, I would have never predicted it. So I honestly have no idea. I hope it gets better because I still have a long career left that I want it to be better.
Think of them as guardian angels, but for EMS, not crime prevention. The Cochrane EMS Crisis Citizen Action Group is exploring the idea of training civilians in CPR and first aid who can be called in the event of a 911 response delay.
It means that we could get somebody on the spot right away. They would arrive at that house. There's somebody who can be calm and non-emotional. They can assess that situation.
If we had a magical wand and we could take back our service, we could run our service a lot better than the province, that's for sure.
The town is taking matters into its own hands, even as the province responds to the EMS crisis by adding $64 million to the budget. And in January, AHS unveiled a 10-point plan to address the ongoing pressures. That includes measures like hiring more paramedics, buying more ambulances, and managing non-emergency transfers between hospitals. And after a new premier was elected in Alberta in October,
I mean, if you've watched the CTV
story that that was aired a couple of, I think just yesterday on this. We clearly have made a wreck of ambulance services, and it's been successive governments under successive banners who have done it.
Healthcare reform is among Premier Danielle Smith's priorities, starting with the firing of the AHS board and the appointment of Dr. John Cowell, who will work directly with AHS executives to continue and add to plans already set out by the UCP to fix the EMS crisis and bring down response times.
One of the things that we have to make sure that we do is that when ambulances show up at a hospital, there is an effective way to offload patients and onboard them in hospital to somebody who can provide continuous care and get those vehicles back out into the field.
That's part of the issue because the whole emergency department is backed up. And so it's looking to flow not only from EMS to the handoff in the emergency department to admissions into the emergency department, admissions inpatient to hospital, and then potentially alternate levels of care. So whether it be in-home, whether it be in a continuing care setting or other form of alternate level of care, so we can move them through the entire system.
Other commitments from the government include allowing EMS dispatch to downgrade calls from 911 to HealthLink if appropriate, and having paramedics to triage patients to determine if they need transport to the hospital. Progress will be tracked and the data will be made public. In addition to the funding specifically for EMS, Health Minister Jason Copping says $1.8 billion will be invested into AHS over 3 years.
On the highest we've ever spent ever on the expense side for on healthcare, adding staff, and that includes paramedics, and then also continue to add staff within our emergency departments, adding spaces in our continuing care system, so that allows for more flow in offload.
But Brian Winter says the plan doesn't address flexing rural ambulances, which he says needs to stop immediately. As for non-emergency transfers,
we have a private service in Cochrane. They have told us that they would take the transfers into Calgary.
Alberta's chief paramedic Darren Sandbeck says the need to make rapid changes to the system comes after the province saw a 30% increase in call volume since last spring, a stark difference from the 4 to 6% annual increase normally experienced.
We planned for that. Where we could, as budget allowed, added resources to the system. But frankly, we were probably behind in adding resources.
Paramedics say some of the ambulances in the current fleet are broken down and others on the street are well overdue to be retired. Sandbeck says they're having a tough time buying more. 134 have been ordered, but they've received less than 30.
That requires us to manage our existing fleet. We're hiring at a rate that we have never hired before, over 200 staff.
Nobody's joining the system. We have postings all across this province we can't fill. They've saved a hell of a lot over the last 15 years by not hiring any, so it's going to take a lot. And they will say that we hired a few, but they will never compare that to how many they've lost that week or how many have exited the system. I'll tell you right now that we're sitting basically where we were 10 years ago for members. It's not grown a lot.
The NDP has been critical of the state of EMS, saying the focus should be dealing with the opioid crisis, getting paramedics off shift on time, and offering new recruits full-time positions.
That 10-point plan came out at the same time as the government was demanding wage rollbacks from paramedics. More plans to make plans, more committees do not help the frontline workers who are struggling right now.
As for the other cities across the country, they're also dealing with their own EMS issues. In rural BC, an 8-month-old baby died while waiting for an ambulance. There were none in the town to respond. And in Montreal, a 65-year-old man passed away while waiting more than 11 hours for help. But comparing red alerts and hospital hallway waits to Ottawa, a city with a similar population to Calgary, we found in 2022, Ottawa paramedics spent 174 hours a day waiting in hospitals, while Calgary paramedics spent 334 hours a day waiting in 4 of the city's main hospitals. And for red alerts, Ottawa averaged 5 a day, while Calgary averaged 15 a day. On the issue of morale, Chief Sandbeck acknowledged it's a concern.
We need to do a better job of being out and talking to our folks, being out and engaging our folks.
I don't think your medics are out there trying to stir things up. You know, I found it difficult to find any of them to speak on the record because they're scared of reprimand and discipline.
I understand that, but I don't think that we've ever disciplined or reprimanded anyone for speaking up.
But a Freedom of Information request revealed an Airdrie paramedic, Ryan Middleton, was disciplined earlier this year. Records show AHS suspended him without pay for social media posts about EMS on his personal account where he doesn't claim to be representing his employer. The documents show he was also disciplined after his wife spoke to media on her own accord. Documents also show that Sandbeck is aware of Middleton's case. In an email he states, "Can we discuss, please, overall approach to this individual? We need to find a different path in dealing with him and his spouse." But when CTV News asked AHS about it, a representative said they can't comment on internal disciplinary matters, and AHS doesn't regulate, restrict, or direct private or personal views or opinions of individuals. Middleton declined an interview as he awaits arbitration. However, those familiar with his situation are outraged.
What kind of system is it where you are muffled? What kind of system is that you are punished or you have to disappear if you speak out about the truth of a work situation?
The work environment is so toxic that I don't think anybody in the current leadership doesn't matter what they do, they'll never fix it.
Can the system be fixed, and how long will it take? These are questions the people who've been gravely impacted by the EMS crisis wonder. It's too late for Andy, Candace, and Sierra, but they too still want to see changes.
Are you optimistic, at least, that there will be meaningful change?
Not right now, I don't. They can say all they want, right? But like, the proof's in the pudding. I need to see it.
It's easy to make empty promises or turn it into a political thing where it's, oh no, it's because this party is in power, or this party is in power. It's like, okay, what are you actually doing to improve things then, other than saying what you're gonna do and not getting them done?
If you had an opportunity to sit down with people who could fix this, would you?
Oh, in a heartbeat. In a heartbeat. They need to see the people they're affecting. It's, you need to see the people's lives you affected. Because we're people, and you're costing people families and loved ones, and you need to realize what's going on here.